Hi, good afternoon, good evening, everybody. I am speaking with Dr. Smikle, the Medical Director of Laurel Fertility Care today, and we're going to be talking about financing fertility. So, all the options that you may have available, how LFC, Laurel Fertility Care, support their patients with financing options to make IVF and fertility treatments achievable and helping people who may need the support. So whatever your situation, do listen, and any questions please ask. We will invite Dr. Smikle in now and get started, so please have your questions ready. Nice to see you. Hello, nice to see everyone today. Hi, Dr. Smikle.
Hello, how are you doing?
I'm well, thanks. How are you?
I'm doing okay. Can't complain too much. Wonderful seeing you again.
You too, and hi to those who are joining. Today, we're going to be speaking about financing options for fertility. So, before we begin, please could you give yourself an introduction, Laurel Fertility Care, an introduction, and then let's answer some questions and go through some very important information that people should know.
Okay. Well, my name is Dr Smikle. I'm the medical director of Laurel Fertility Care. We are providers that have been seeing patients in the San Francisco Bay Area for more than 15 years now. We have offices in San Francisco and Oakland in the Central Valley. But we've been caring for people from all over the world in terms of patients with a variety of disorders. So again, this is a really timely topic in terms of financing the costs of fertility. So we're happy to kind of basically, at least share our patients' experience as they go through the process.
Mm-hmm. It's something that we find our community ask about a lot, and I know that insurance policies can differ hugely in the US, and sometimes as a starting point it can be difficult for people to know what options there might be available, and given the economy at the moment and the instabilities around the world, it seems like a good topic to be covering to answer those questions. So if someone's starting treatment, whether that's IVF or other routes, the first thing they might need to think about, even when booking a consultation, is how am I going to pay for this? What is your
Correct.
thoughts in terms of starting that process and options?
Well, it's great that you brought up some of the challenges patients face now, but I also say that along with those same challenges, there are a plethora of choices that patients have now in terms of either self-financing, basically providing funded care and going through third-party options. So the opportunities are great in terms of considering things now, and much more so than before.
Mm-hmm.
I do think one of the things that you talked about is a challenge in terms of going in, having your hopes, really, at the forefront, and then thinking through what your choices are. I'm going to basically have my child, and then be, faced with a lot of the expenses that are associated with that can definitely sometimes be overwhelming. And I think the key thing that's important to know is first, really think through what your choices and what your goals are, because many times when you're thinking about the process, you might actually fall short of what your goals are if you're thinking of that only the cost of the processes. But at the same time, you have to basically realize that you're trying to basically have a child. That child is associated with a lot of their own costs. So really financing one option and not leaving your options for the other is something to consider as well. So
Absolutely.
from a holistic standpoint, we always try to say you need to balance all those measures, if you will.
Mm-hmm. Apologies if there are noises in the background. My dog is making very strange noises this evening. Okay, so financial options available at Laurel Fertility Care. Please could you tell us what they are?
Well, we're fortunate in terms of, we're in an
Sorry,
area where, that's fine.
apologies.
Continue what
Literally
Dr. Jones
never
was saying.
does that.
No,
Yes, please tell us
understandably so.
everything.
Now, and I think we're fortunate in terms of being in an area where there's a lot of technology-related companies that afford care for their patients. So they may either have Progeny, Kindbody, Carrot as basically administrators for those patients. And it provides an opportunity for those patients employed by some of those technology companies to go through, whether it be egg freezing or embryo cryopreservation or building their families, but, the companies will actually, at least afford them some cost savings in terms of that approach.
Hmm.
That may be free care or fully covered benefits or partial coverage. So therefore, it's important. The
There's
other thing, I'm sorry.
no, please continue. I'll ask you in a second.
There are other things that we have in terms of, basically, there are several. There may be nonprofit organizations where there are groups that basically have decided that what they're going to do is to help other couples go through. For gay male couples, you have men having babies, supporting family building through their programs. You end up having others that are actually providing, I think the Knot is one that actually provides some sort of assistance for patients going through. And, we're associated with many of those. For those individuals who are paying, out of pocket, we also work with several third-party companies that basically allow them to finance the cost of those care over time. So those are actually several different choices patients may have in terms of affording, their fertility treatment.
And if people are looking for those options, where do they go? Do they call the clinic? Do they look on your website?
Well, sometimes the because many of these companies are national or even global, patients may actually reach out through the third-party administrator first, and they'll actually refer them to our clinic. So that's one way. Another is basically going through our website, where we do have a financial page on that site that walks through all those choices and provides links for patients to at least explore those options as well.
Mm-hmm. Speaking of which, you have a beautiful new website. So we will link that up in our bio so that people can check it out, find these resources, and get the help and ask the questions that they need. In terms of those first steps, because it kind of depends on a company that people might work for, doesn't it, in terms of the insurance that they might, or the cover that the help they might get through work or through their provider. So would you normally tell people to go and speak to their provider first, or would you do that on their behalf?
Well, many times the patients may come in and they have questions, and we'll find out, or we'll ask what are where they work, and then we may recommend that they actually go through their HR departments to find out if they have access to or they have coverage. It's harder for us if we can go to the insurance companies and basically work through on their behalf to get to find out information about what benefits they may have. But it's harder to basically go through their HR department, because they're not going to really relate information to us. So what we'll do is basically provide the questions patients may need to ask their HR departments, just so they can get a better understanding of what those choices are.
Mm-hmm. Laurel Fertility Care, your team, are also writing the most brilliant article with us at the moment, all around these options. So we will be linking that up in the bio. Everyone should check it out, because it's hugely useful and covers lots of different scenarios and options, caters for all. So it's definitely a resource to check out. So do follow our link in bio. And I wanted to ask, because I'm sure you see this a lot with patients, if time isn't on your side and you're looking to have fertility treatment or preservation, whatever it might be, and you are concerned about financing it, what do you say to patients who are kind of more so in a rush, if you like?
Well, I think I'll give two examples. There are patients who are going through in a rush for really strong medical reasons. I'll give an example of patients who have recently diagnosed with breast or some sort of cancer, where their finances are actually going to be really poorly timed to their need for treatment. So therefore, those patients don't have time to delay, nor do they have time to make any decisions. So many times, the consideration is, do you do this at all, or do you give up that opportunity? And so one of the things that we try to help patients kind of work through and talk them through the process is, really need to look beyond what your immediate goals are and figure out, what you truly want.
Hmm.
And, one of the things that we'll try to do is, one, provide resources where they can actually go and explore. For patients with cancer treatments, they can go through Fertile Hope or some other organization that helps patients with a cancer diagnosis. Others who may not actually have access to that, or they don't have a cancer diagnosis, who age is more of a factor, then we have to truly ask, what are your goals? Are you willing to basically say, I'm going to forego having a child because I'm going to not be able to afford this, or are there ways you can kind of basically stretch to reach that goal? The goal is to basically make it so therefore we can kind of have patients really truly explore what their options are, because many times those options may be related to either preconceived thoughts or ideas about what their process they should go through. But importantly, they have to make some decisions, sometimes hard ones, in terms of how much they're willing to intervene. Others, they don't really have a choice. They may say, well, I don't have the resources. And therefore, you'll say, well, we can try these other either less aggressive measures, or ones where there's less stimulation involved, but still provide an opportunity. So those patients are ones that may end up seeking or choosing different choices or different options, simply because finance is the one they can't stretch beyond. And fortunately, we work with several pharmaceutical companies that sometimes will help in terms of providing some of those medicines that they're significant cost as well.
Mm.
So being able to afford some of those is going to basically be helpful in terms of them going through the process.
That's a really good point, because I remember with my second cycle, my stimulation was a lot higher. My
Mm-hmm.
dosage was much higher than previously, and the cost of the medication was really high,
Right.
in the
Mm-hmm.
thousands. And so yeah, it can be a huge part of IVF, for example, that you may not have considered when looking at your
Correct.
options.
Correct. And then there are patients who may end up having the insurance benefit to cover the cost of the cycle, but not to cover the medications.
Mhm.
So simply because you end up having some treatments that are covered doesn't necessarily mean you're out of the burden, having to consider the financial burden of going through the cycle, because all these costs or co-pays, all they're going to factor in. Fortunately, some patients will actually go through and they'll be able to have some insurance coverage and then bridge it by financing some of the other costs associated with it. So they'll have to kind of think through some of the choices and options they have. But importantly, what we're trying to provide and trying to educate patients about is just that, everyone has some choices. It may seem that, it's not the ideal choice, it's not going to be the optimal one if you were under ideal circumstances, but, at least we'll let them know what their choices are so they can have some informed decisions about what processes they can kind of consider.
I think also on the medication front, I presume that you work with your patients so that if, rather than needing to buy an entire new pen of medication, are there routes to kind of buy on almost a daily basis or a short term, so that you don't need to overbuy medication that you might not end up using?
That's a really critical part. I think one of the things that we try to educate patients about is just that in terms of manufacturing the medications, the manufacturing, in fact, manufacturers are always going to build in some sort of safety net that we utilize in terms of helping patients go through. We can't tell them that a Gonal 450 pen has more, because that's not what the manufacturer allows. But we can say, well, if you use a different device to extract the medication, then you might actually have some added benefit. It may not be a lot, but it may be enough to where you're actually reducing some of the costs associated with purchasing the medicines. Additionally, if patients are basically buying what they need rather than buying the entire thing all at once, then you may end up having to say, well, these are things that we can do. We can help out in terms of, trying to make sure taking the most amount of medicine with the least amount of leftover, just so you're not basically having, the cost of those linger. Because, if you're not going through a subsequent cycle and you have medications left over, many of those medicines are going to expire. And so therefore you have to have that as part of the consideration.
How long do the medicines usually last for if they're refrigerated?
Well, medications that are mixed that are actually in use are usually only good for about 30 days or
Okay.
less. So therefore, if someone actually has an unopened package, then that may last through the manufacturer's, basically shelf life. So many times when you're going through, many of the medicines are being shipped are going to end up having a 6 to 12 month shelf life. So if you're not complete with your cycle or you're going to delay your cycle for whatever reason, you're not going to have to basically worry about the medicines themselves. However, if you started a cycle and then let's say your cycle got canceled for some reason, some of those medicines may be useful for the next cycle. Others you'll end up having to kind of repurchase. So those are all the things we walk through with patients. So therefore, they know their options.
Great tips, great tips. You mentioned briefly previously about grants and loans and other options out there of seeking cycles or medication treatment. Could you tell us a little bit more about ones that you've come across that people might be able to look into through your support?
I think one of the most established, at least granting processes are the men having babies, who it is geared towards same-sex couples, primarily men who are going through the process. And they have probably one of the most robust treatment options because they partnered with, other organizations and also they partnered with other financial groups that basically afford some patients to go through without any cost, including cost of medicines. So that's the most generous. Some of the other ones, actually, Carrot is one where you can either sign up on your own or sign up with other individuals who basically, and it's some through insurance or through your employer, will provide some benefit, but it's not going to be a substantial part of the cost, but enough to where you're going to go through that process and actually be afforded some care. The other ones, I know that Resolve and some of the other national organizations do have grants, so that's important to know. But they're always small groups and opportunities that are there. So, that's where, basically trying to educate yourself about the process, trying to basically get support. We partner with a number of different groups similar to yours that basically will also link to other groups. So it's basically a cascading group of advisors, if you will, that'll always help. The goal is to support patients as they go through the process. So that's an important thing to realize.
Well, for example, when we met in October, you had the most incredible egg freezing event where you gave away complimentary egg freezing.
Right. Yeah, and I think that's actually true, and not just our organization, some of others do as well, where you'll go through some sort of promotional activity where you're actually meeting with a group of individuals, educating them about the process, and in those groups, we're going to end up, either giving away coverage for a cycle or giving away, partial, cost for the cycle, so the patients will end up having to go through at a lower cost. Those are all helpful. And other organizations do the same. The great thing in terms of some of the things that we've been fortunate about is we've partnered with some of the drug manufacturers to then include some of those costs as well. We can actually contribute our services, but we don't control medication costs. So partnering with a pharmacy, partnering with a drug manufacturer is really helpful because they will be able to kind of help to kind of reduce those costs as well. So that we've been really fortunate in terms of having those partnerships as well.
Yeah, fantastic. You're doing great things. So thank you so much. For anyone who's just joining, please do head to our link in bio to find out more about Laurel Fertility Care, all of the financing options and the fantastic resources that you have available for your patients. Do you find that sometimes people are apprehensive about even having that initial chat or conversation, worried that that will be a trigger to, costing them a great deal of money? Would you always say, come and have a chat to see what's possible first?
I think that brings up the question in terms of the fear and the apprehension versus the information that you might gain. And oftentimes, what I'll talk to patients about, either in terms of providing, phone consultations or telehealth consultations or just by seminars, educating them that, knowledge is really a significant part of your empowerment. And although it may cost, some small amount to basically go and get that information, that may be far more worth it than anything else, even if you decide you're not going to do anything at all. The reason for that is that you may be educated about just in terms of what your barriers are, whether it be sperm, whether it be egg, or whether it be anything else. And so you have a much more realistic sense about, what your chance and what your opportunities will be. Some patients will actually have great opportunity, and so therefore all they're trying to do is to get information about timing and about, what other things they can do on their own. And that's probably the most helpful parts. Others are really concerned because, they have limited resources. So therefore, even spending the small amount that it may take to come in for a conversation, they're really feeling that that's something that they can't bear. I'd say that, for some patients who are struggling and, you're trying for 6 months or a year or even longer, getting information is going to be far better than actually kind of continuing that course, that grind, because the emotional toll, the relationship toll, all the other tolls that come along are going to be far greater than actually not having the information you may need to basically change that outcome.
Definitely. Someone asked earlier if they could ask a couple of questions about IVF protocols. So if you're happy to answer those, and that person,
we're happy to answer those. That's fine.
In the meantime, I think another really good point that you talk about in the article, which we'll link up in the bio, is be careful and be wise about the decisions you make, as in who you're choosing, who you're spending money with, because you want to make sure that you have a high level of support from a trusted clinic, so that you're putting your efforts into the right place.
Well, I think another way of saying that part is just that the unfortunate thing is just that, the process itself involves a lot of both trust on your part and also trust on, basically making sure you're going to put in the best foot forward, but really, realize what your goals are, and then make that, have firm conversation, the decisions about what you should do, and only do what you're comfortable with, because you might go to someone who basically are saying that your only choice is basically going through an IVF cycle, when, especially when you're younger, you might want to consider other choices first, if age is not something you have to factor in. Unfortunately, we also going to have individuals who IVF becomes the only choice, or individuals where, unfortunately, IVF is not a choice at all because they don't actually have either the eggs or the sperm to allow them to have success. So they have to consider their options. Going to a place where you're going to actually have realistic information about what your decisions are will, in the end, be more accommodating, if you will, because essentially you're not going to go towards treatment that may be either not necessary or with really poor chances for success. Mm-hmm. Sometimes you might choose to go through in spite of being told, well, your chance of success is low. That's a different choice. But getting that information and making the decision that, you're going to try something despite the choice is one decision versus, well, this is the only choice you have because that's what I was told. That's basically not getting the information you need. So getting the information is important.
Mm-hmm. Do you find that some people go down the IUI route before IVF due to cost, or is that due to other circumstances?
I think sometimes patients will come in with the perception that IVF is just too costly, and therefore I'm not going to try IUI. IVF, IVI is going to be a lot, less invasive and a lot a cheaper cost for treatment, and many times it is. However, what you need to balance is just that someone who is 42 going through an IUI cycle, although that is a less expensive cost, the chance of success may be lower. So therefore, what you're doing is balancing cost versus chance of success. Mm-hmm. And so if you're going to go through and then have to pay out of pocket for 3, 4, or 5 IUI cycles, you may be better off going through one IVF cycle and then improving your chances a whole lot more. Those are things, and those are conversations to have, that sometimes the more aggressive treatment may end up actually being cheaper because you're not going through repeated unsuccessful attempts. And that's a factor that we talk to patients about as well.
Well, that comes back to the point, doesn't it, of choosing the right provider, asking the right questions, and ensuring that you're getting top advice so that you can make informed decisions with everything presented to you.
No, I think that's actually true. I think, you need to be part of the conversation, you need to be part of the decision, and you need to basically get information to make some right decisions for you. And then, again, the decisions are yours to make. The decisions are what affects your life. So therefore, it's going to be important to actually have a clinic, a partner who's going to help you through and guide you through those decisions, not basically say, well, this is your only choice, and then say, this is what you have to do. And most times, even if the odds are really small, you may have different options. You need to figure out what those options are and what's comfortable, what's right for you.
I love that advice. Anything else that you want to leave us with today regarding financing options?
I think the most important part to think through and to understand is just that rather than thinking, especially in the beginning, about that finances are going to be the only thing to consider, I think the most important thing is to focus on the information you may end up gathering. And then getting the most information and making the right decisions. Getting information about sperm, getting information about egg, getting information about egg quality, getting an AMH level so you know what you're dealing with. All those pieces are going to help in terms of creating adding to that foundation, if you will. That's going to be the foundation for your success. So the goal is to basically always focus on your success, because that ultimately is what's going to help in terms of having you have your family.
Yeah, brilliant advice as always. Thank you so much, Dr. Smikle, for your time today. We really, really appreciate it. And for anyone who's watching back, please do head to our link in bio to read all about Laurel Fertility Care, your financing options, ways to make it work, and all of the wonderful support that you provide. So thank you as always, and thank you to those who have joined.
Well, thank you, and thank you for allowing us to kind of basically bring this to your following as well.
Absolutely, absolutely. We'll see you very soon. Thanks, Dr. Smikle.
All right, take care now. All right,
Thank you.
bye-bye.
Bye-bye. Bye.